In the diagnosis of asthma in less than 5 years of age, we have seen significant strides over the last 5-10 years, and GINA has been making those changes accordingly. In the latest change, what we have seen is considering the three factors. One is the symptoms, then no likely possibility of other diseases, and the response to treatment in acute and chronic form. Previously, we used to have the asthma predictive index, then we have the modified asthma predictive index, and then you give, when you have very high probability of asthma, you start the child on inhaled corticosteroids, you see the response, child gets back another event of wheezing episode. That's when you label the child as asthmatic. These were the criterias in the past. What GINA has done is now to take the recurrent episodes, no likely alternative diagnosis, and timely response to acute or long term asthma treatment. So, in the first, you should have all three criterias to call it as asthma. Among the recurrent episodes, you have the wheezing episodes, at least two episodes in the previous year, and one acute wheezing episodes which has lasted for more than 24 hours, and the child also has had in between symptoms of cough, wheezing, and day symptoms, night symptoms, exercise induced symptoms. All these things are there, should be there, to make it as recurrent episodes. And there is no likelihood of alternative diagnosis. It can be a recurrent upper respiratory tract infections, GERD, or a foreign body, or a pertussis, protracted bacterial bronchitis, tuberculosis, and so on. If you have noticed the child does not seem to have any of those symptoms, then you come to the third and probably the most important criteria as a pediatrician, what I would see, and that is timely response to acute or long term asthma treatment. Acute wheezing episodes, which are treated in the hospital, and the child responds in 20 to 60 minutes. In case of severe episodes, you give SABA, that is short acting beta agonist, with oral corticosteroids, and the child responds in next 3 to 4 hours. That again is a very good indicator to say that the child is going to respond to long term inhaled corticosteroid treatment. And at home, whenever any parent or a caregiver notices the child is having wheezing episode and they give their medicine, SABA, that is short acting beta agonist, the child responds in next 20 to 60 minutes. That is again very gives you a very positive response that the child has asthma. And the last and important criteria is you give a trial of 2 to 3 months of inhaled corticosteroids or inhaled corticosteroids with short acting beta agonists, and parent reports a significant decrease in their events of cough, cold, and wheeze. It is very much suggestive of childhood asthma. Um, Among, when do you consider putting on the child on inhaled corticosteroids? At least one acute episode, which is very severe, or having at least two episodes of cough per week, or more than one episodes of waking up in the week, which has extended for a month. That is when you consider putting the child on a trial of inhaled corticosteroids for 2 to 3 months. Having all the three boxes ticked, you make a diagnosis of asthma in a child less than 5 years. These are the significant changes what GINA has brought in for 2025.